Is that, tell me about your inspiration for, I guess for our listeners that may not be aware of this, because I recently just learned about it since I moved to Kansas City. I had never
Mhm.
heard of it before, but direct primary care, is that, what does that mean exactly?
Yeah. Okay. So like I said, my dad got paid in tomatoes and all this stuff. That's not what medicine is now. I think that you don't have to be unique to Kansas City or Kansas or anywhere. You just have to be an American to know that our health system is lacking, for lack of a better word. It's not great. And so direct primary care is sort of a relatively new in the last 10-15 years, um, recapturing of medicine by physicians,
Wow.
instead of what we traditionally think of with healthcare, which is you call your insurance company and you find out who's in network and then you go to them, in 6 months when they have an availability, and you sit in the waiting room for 3 hours and then you get 10 minutes and you only get three questions. And if you have more questions, you have to come back. And if you're in pediatrics, if they're a well child, but they also ask sick question visits, then you get billed twice. And then if your kid gets sick after 5 p.m., you call a nurse line or you go to the ER because there's no one available. Direct primary care kind of stops all that. So instead of patients going to just an in-network physician and finding someone that accepts their insurance and being one of 1,000 patients, they see me and they pay me a monthly fee. I do not bill insurance at all. And that gets all their pediatric care. So all their well visits, it gets all their sick visits. If they need stitches at 5:30 on a Friday night, if they start
Oh,
puking on a Saturday morning, they just get a hold of me. So my patients can text me, we can video chat, um, and they get just a lot more continuity and a lot more comfortable. And it's a real relationship, as opposed to just a doctor and a numbered patient, because I know them. I know this family. I know these children. And I can follow them a lot more closely. So there doesn't have to be as much like medicalizing it, because I don't know when I'm going to see you again. In the traditional
yeah.
clinic, I don't know when I'm going to see you again. So I'm going to have to give you this antibiotic and just hope everything gets better. Whereas I can watch things more closely. Um, and then my patients can talk to me on a Saturday morning or a Friday evening or whatever and let me know how things are going. But I'm able to do that because I don't bill insurance.
Oh, that sounds like a great model. I have so many, I have so many questions that I'd love to go down a rabbit hole on. So I probably will have to come back and talk with you more about this entire setup.